In this video, we are going to discuss the importance of exploring the patient's medical history during their facelift consultation with Dr. Buonassisi. Your surgical consultation, aside from the surgery itself, is the most important part of the cosmetic surgery process. Dr. Buonassisi's patients are guided through a well-defined process which helps to ensure that they are well-informed and good candidates for a facelift procedure. Your discussion with Dr. Buonassisi will begin with the review of your medications and medical history. There are some medical conditions or prescribed medications that make facelift surgery inappropriate for some people.
Prior to any facial rejuvenation surgery, it's important to know about patients' medications, whether or not they've had any significant medical illnesses in the past, and if they're a smoker. The medications we're most concerned about are blood thinners. Patients on blood thinners have a much higher risk of developing hematomas and bleeding after surgery. In patients who are on prescription blood thinners, they need to get permission from the prescribing physician to stop those medications for several weeks prior to this type of surgery. Non-prescription blood thinners also need to be stopped at least 2 weeks prior to surgery. Those include drugs like ibuprofen and aspirin, but there are also many herbal and natural supplements that do thin the blood that need to be stopped as well. Patients who have significant cardiac disease or uncontrolled hypertension may not be good candidates for cosmetic surgery. If these situations can be controlled and managed, then it's possible to consider surgery, but they do need a preoperative consultation with their internist prior to considering the procedure. Although smoking is not an absolute contraindication to surgery, larger procedures like facelift and neck lift surgeries are probably best done in patients who don't smoke or in patients who can quit smoking prior to the procedure. The bottom line is that smokers don't heal well. Smoking causes poor blood flow, and blood flow is what allows your facial tissues to heal properly. So in patients who smoke, they have a much higher risk of developing wound healing issues, hematomas, and scarring that is more prominent than those who don't.
We've just discussed the importance of exploring the patient's medical history. In our next video, we'll see how the patient's objectives are uncovered and discussed as part of any comprehensive facelift consultation process.